Dear student, I am Dr. Prakash Mungli, Professor of Biochemistry. So, in this lecture, I will be explaining you digestion of carbohydrates. Followed by this lecture, I will be explaining you absorption of monosaccharides which are coming out of digestion of carbohydrates. Now, let's get into the details on digestion of dietary carbohydrates. Now, the major digestible dietary carbohydrates that we get in our food is starch, which is coming from plant source, glycogen, which is coming from animal source, especially in the form of skeletal muscle, lactose coming from milk and milk products, and sucrose coming from table sugar. Okay, so these are the major dietary digestible carbohydrates that we get in. Now, there are something called like indigestible carbohydrates that we get in our food. What are the indigestible carbohydrates we have? It is plant fibers which contain cellulose, because cellulose, the type of bonds present in the cellulose, beta 1,4 bond present in cellulose, we cannot break them. So, cellulose is indigestible. Like that, we have hemicellulose, pentasons and inulins. All these things we cannot simply break, although they are carbohydrates, but these are not digestible in our intestine. So, these are indigestible carbohydrates that we get in our diet. Now, what are the enzymes that will digest carbohydrates in our intestine? So, it is the alpha-endoglycosidases. Alpha-endoglycosidases, they are responsible for breaking alpha glycosidic bond or alpha-1,4 glycosidic bond, which are generally seen in starch and glycogen. So, these are endoglycosidases. Endoglycosidases means they can break alpha-1,4 linkage within the chain, not the very first one, not the last one. So, the first and last alpha-1,4 bond cannot be broken down. It is the inside alpha-1,4 bonds can be broken down. That's why these enzymes are referred as alpha-endoglycosidases. And now, humans cannot synthesize a beta-endoglycosidases, and that's why we cannot break a beta 1,4 bond present in cellulose. That's why it is an indigestible carbohydrate. Now, where exactly carbohydrate digestion begins in our digestive tract? It is in the mouth. Always remember, dietary carbohydrates digestion, it begins in the mouth and it is continued as it goes into the small intestine. Okay. Now, in the mouth, we have an enzyme called salivary alpha amylase, and in the intestine, we have pancreatic alpha amylase. Both salivary alpha amylase and pancreatic alpha amylase, these are alpha endoglycosidases. What they will do, they are going to break alpha-1,4 bond present in the starch and glycogen. And then along with the salivary alpha amylase and pancreatic alpha amylase, so we do have brush border located carbohydrate digestive enzymes. What are the brush border located carbohydrate digestive enzymes? There are specific enzymes for like sucrose, maltose, lactose, isomaltase. So, these specific enzymes, they are taking care of specific disaccharides and also oligosaccharides. So, with the concerted and collective action of salivary alpha amylase, pancreatic alpha amylase and brush border located enzymes, the dietary carbohydrates are ultimately broken down into their monosaccharide forms, and monosaccharide forms are the ones that are absorbed into the intestine from the lumen of the intestine. Okay. So, monosaccharides are absorbed into the enterocytes by two types of mechanism, which we are going to go into details later in the next chapter, and that is sodium dependent absorption mechanism and sodium independent absorption mechanism. Alright, now let's get into what type of digestion will be going on in the mouth. So, because dietary carbohydrates digestion, it begins in the mouth. So, that is initiated by salivary alpha amylase enzyme, which is also called as ptyalin enzyme. Okay, so ptyalin. So, what this does? It's going to break alpha-1,4 bonds present in the starch and glycogen. It's an alpha-endoglycosidase. It's going to break alpha-1,4 bond within the polysaccharide. Now, in order to do that, this ptyalin enzyme or salivary alpha amylase, it needs chloride ions for activation. Chloride ions are necessary for this, and also the optimum pH for this enzyme is 6.7, which is present in the mouth, so it is going to digest carbohydrates like starch and glycogen in the mouth. So provided that a person gives sufficient time for salivary amylase to work on this. Now, digestion starch and glycogen into smaller fragments like oligosaccharides, alpha-dextrins, maltotriose and maltose. This is what is the products that is coming from salivary alpha amylase. So, if sufficient time is given for salivary alpha amylase to work, so salivary alpha amylase, it's going to break alpha-1,4 bond within the polysaccharide and will release alpha-dextrins, which are simplified form of starch and glycogen, oligosaccharides, maltotriose, 3 glucose units, maltotriose, maltose, 2 glucose units with alpha-1,4 bond. So, action of salivary alpha amylase, it will stop once it reaches stomach, because stomach has a hydrochloric acid, acidic pH is there, so optimum pH is not maintained there, and also it will denature salivary alpha amylase enzyme, thereby enzyme will stop its function. So, that's how digestion of carbohydrates in the stomach, it will be stopped by the action of hydrochloric acid on salivary alpha amylase. So, salivary alpha amylase do not have any function in the stomach. So, now there is no digestion of carbohydrate in the stomach because stomach is not releasing any carbohydrate digestive enzyme. Now, when the stomach contraction happens, when the gastric content enters into the duodenum. So, in the duodenum, as the acidic content entering into the duodenum, into the first part of duodenum, so in relation to that acidic content that is entering in, so there will be stimulation of a neuroendocrine glands present in the duodenum, and they will release so many endocrine hormones, and two of them is cholecystokinin and secretin. Now, the function of secretin is to release bicarbonate from the exocrine pancreas, and this bicarbonate which is entering into the duodenum, it's going to neutralize the acidic pH coming from the stomach, and thereby it is going to make sure the optimum pH is maintained for the further digestion of carbohydrate. That's the function of secretin. What about cholecystokinin? Cholecystokinin, what it does, it's going to bring pancreatic digestive enzymes. And one of the pancreatic digestive enzyme that is necessary for carbohydrate digestion here is the pancreatic alpha amylase, which is also called as amylopsin. You know, salivary alpha amylase is called as ptyalin. Now, pancreatic alpha amylase is called as amylopsin. Remember that. So, just like salivary alpha amylase, so this pancreatic alpha amylase also requires chloride as an activator. And what it does, it's going to hydrolyze alpha-1,4 bond present in the starch, glycogen, oligosaccharides and alpha-dextrin, and further convert these molecules like alpha-dextrin into alpha-limit dextrin, and if starch is still there, so it is converted into oligosaccharides, maltose, maltotriose. So, these are the digestive products that are coming from action of pancreatic alpha amylase in the duodenum. So, pancreatic and salivary alpha amylase, they cannot break alpha-1,6 linkages that are present in the branch points, both in starch and glycogen. These are highly branched polysaccharides. So, at the branch point, you see alpha-1,6 linkage, and that alpha-1,6 linkage cannot be broken down by salivary alpha amylase and pancreatic alpha amylase. So, that cannot be done. So, those branch points still remain there. Okay. Now, what happens later? So, oligosaccharides, alpha-limit dextrins, maltotriose and maltose, these molecules coming from starch and glycogen. Along with that, we have sucrose, lactose, which are coming directly from the mouth all the way to the duodenum without digestion in the mouth and stomach. So, all these things need to be handled in the duodenum. So, the brush border located enzymes will take care of digestion of these molecules. Let's look into each one of them. So, now the brush border enzyme that I am explaining first is alpha-glucosidase enzyme. This alpha-glucosidase enzyme, it's going to hydrolyze alpha-1,4 bond of a short linear oligosaccharide into glucose molecule one at a time. It's going to break one alpha-1,4 bond at a time starting from the end and release a glucose molecule into the lumen of the intestine. That's what is the function of alpha-glucosidase enzyme. Remember that, which is a brush border located enzyme. It acts on oligosaccharide, remove one glucose at a time from by breaking alpha-1,4 bond. Now, maltase enzyme. Maltase enzyme it breaks alpha-1,4 bond present in maltose. What is maltose? Maltose, it is a combination of glucose plus glucose with alpha-1,4 bond, and maltase enzyme is going to break that alpha-1,4 bond, both in the maltose and also maltotriose. You know maltotriose, it has 3 glucose with alpha-1,4 bonds attached. So it is going to break that alpha-1,4 bond and release a glucose molecule. So maltase enzyme acting on maltose and maltotriose release individual glucose by breaking alpha-1,4 bond. And then we have lactase enzyme. Lactase enzyme, as it is there in the name, it's going to break a beta-1,4 bond that is present in lactose holding on to galactose and glucose. It is there in the structure. You know, galactose and glucose, it is attached with the beta-1,4 bond. So lactase enzyme is going to break that beta-1,4 bond and release glucose and galactose molecule. And that's a brush border enzyme. Now we have isomaltase sucrase complex. This isomaltase sucrase complex, what it does, isomaltase, it is there in the name, it's going to act on isomaltose. What is isomaltose? So isomaltose, it is 2 glucose units, glucose alpha-1,6 glucose. That means 2 glucose units held together by alpha-1,6 bond. That's generally found at the branch point. You know, at the branch point of starch and glycogen, where alpha-1,6 bond is there. So at the end of digestion by salivary alpha amylase and pancreatic alpha amylase, you're going to get some isomaltose. Isomaltose is glucose plus glucose with alpha-1,6 bond, and that is separated now. So isomaltase enzyme is going to break alpha-1,6 linkase present in isomaltose and release 2 glucose units. And then the sucrase. Sucrase is going to break alpha-1,2 bond present in the sucrose and release glucose and fructose molecules. Thus, concerted action of various enzymes starting from salivary alpha amylase, pancreatic alpha amylase, alpha glucosidase enzyme, and then isomaltase enzyme, maltase enzyme, and then sucrase enzyme, lactase enzyme, all of them, they are going to take care of digestion of starch, glycogen, lactose and sucrose all the way into glucose, galactose and fructose. These are the simplified forms of starch, glycogen, lactose and sucrose. You got to remember that. So that's how we all got monosaccharides now ready for absorption in the intestine. Now what about carbohydrates that are not digested in the small intestine? Because not all carbohydrates are entirely digested in the small intestine. Some of the carbohydrate which moves into the colon without being completely digested, so that will be taken care by colonic bacteria. They will ferment all these undigested carbohydrates into hydrogen gas, carbon dioxide, methane gas, short chain fatty acids. And accumulation of these things, whenever there is too much of undigested carbohydrates going into the colon, that can lead to flatulence, abdominal cramps like pain in the abdomen, and then osmotic diarrhea, because these undigested carbohydrates are osmotically active molecules. So they can pull water down into the lumen of the intestine and lead to osmotic diarrhea. Now there are certain drugs that can be prescribed, especially in the treatment of diabetes mellitus, to control postprandial blood sugar rise like after meals. So those group of drugs are referred as alpha glucosidase inhibitors, that will inhibit alpha glucosidase, which is responsible for digestion of oligosaccharides. So these oligosaccharides are entering into the colon, and from there it is bacterially fermented, and there's basically glucose is not absorbed, right? So that will to certain extent decrease the spikes in the glucose after meals. What are the alpha glucosidase inhibitors? Examples, we have acarabose, miglitol, veglibose are alpha glucosidase inhibitors, and these are used in the treatment of diabetes, and they will lower postprandial blood glucose levels. Now, starch, lactose, sucrose and cellulose, these are the things that gets into our body. So they will initially be digested by salivary alpha amylase into alpha dextrins, isomaltose, maltose, lactose, sucrose and cellulose, and then they go into the duodenum, small intestine, where pancreatic alpha amylase is going to work on that further, convert alpha dextrin into alpha limit dextrin, and that further digested into isomaltose, maltose, lactose and sucrose, and then brush border enzyme comes in. And the brush border enzyme specific ones, we have isomaltase sucrase complex, lactase enzyme, alpha glucosidase enzyme. So they are going to take a maltase enzyme, they are going to take care of further digestion, and ultimately we are going to get glucose, fructose and galactose absorbed directly into the portal system, whereas cellulose just goes out in the feces. So this is what happens to our dietary carbohydrates, especially starch, lactose, sucrose and cellulose. Remember that point there. Now let's go into an applied clinical aspect related to digestion of carbohydrate, that is lactose intolerance. Now the lactose intolerance is because of deficiency of lactase enzyme. Because of that, there will be inability to digest lactose that is coming from milk and milk product. Okay, so it is the most common form of disaccharidase deficiency that is seen. Normally what happens is lactase expression is highest shortly after birth, and it is going to decline as we age on, even despite continue to consuming lactose. That's how the lactase expression is genetically mediated there. So especially like Asians, South Americans and Africans, they show a relatively higher incidence of lactase deficiency by population genetics. Now, what are the symptoms of this lactase deficiency, which is referred as a lactose intolerance? So it is symptoms of lactose intolerance include loose stools, abdominal bloating and pain, flatulence, nausea and barborrhizmy. Barborrhizmy means like increased sounds in the abdomen. Okay, so how do you treat this? You just need to avoid milk and milk products, which will help to alleviate signs and symptoms of lactose intolerance. Okay, coming to what are the different types of lactose intolerance that we can see. One is a congenital lactose intolerance. It is an autosomal recessive condition. Lactase enzyme expression can be deficient genetically there. In the primary lactose intolerance, it is due to low levels of lactase enzyme, which will develop soon after childhood. And then we have secondary lactose intolerance, secondary lactase deficiency. It is because of secondary to an acute abdominal infection, like acute illness, like viral diarrhea or something, or diarrhea because of some other cause which will erode intestinal epithelium, where lactase enzyme is eroded, or any effect of medication onto brush border enzyme. So that eventually may lead to diarrhea followed by certain medication or followed by certain diseases. So that is what is referred as secondary lactase deficiency. So it is congenital lactose intolerance, primary lactose intolerance and secondary lactose intolerance or secondary lactase enzyme deficiency. Now, how do you diagnose lactose intolerance? So there are certain diagnostic tests here. So that is a lactose tolerance test, milk tolerance test, breath hydrogen test and dietary lactose elimination. So out of all of them, the diagnostic test is breath hydrogen test. Let's get into each one of them. In lactose tolerance test, what they will do is 50 grams of lactose is given, and followed by that, like at 0 hour, glucose is measured, and then 60 minutes glucose is determined in the blood, and 120 minutes glucose is determined in the blood. It's like 50 grams of glucose followed by at the time of glucose given 0 time. So blood sample is taken for glucose determination, glucose level, 60 minutes and 120 minutes, means 1 hour and 2 hour blood is taken. Now if the blood glucose failed to rise more than 20 milligram per 100 ml of blood, it indicates there is a lactose intolerance or lactase enzyme deficiency, because lactose has to be broken down into glucose and galactose and it has to be absorbed. So if that 20 milligram per deciliter blood glucose, if it doesn't rise, it indicates lactose intolerance. So this is what is called as lactose tolerance test. Now then the milk tolerance test. Milk tolerance test means 500 ml of milk is given after overnight fast, and then blood glucose measurement is done. So if the blood glucose doesn't rise more than 9 milligram per deciliter, so if it is less than 9 milligram per deciliter, if the rise in the blood glucose is less than 9 milligram per deciliter following that 500 ml of milk, So it is indicative of lactose intolerance. Now the breath hydrogen test is a diagnostic test for lactose intolerance. Here, after overnight fast, when lactose is supplemented, lactose is given orally, and then after the lactose is given, so every 30 minutes followed by that lactose intake. So the expired air, that is exhaled air sample is collected for next 3 hours, like every 30 minutes this exhaled air sample is taken, and breath hydrogen levels are measured in that expired air. So if there is a rise in hydrogen in that exhaled air, like 20 parts per million, hydrogen concentration more than 20 parts per million, if there is rise of hydrogen like that, so it indicates that there is a lactose intolerance, because the bacteria is fermenting this lactose in the intestine and basically increasing the hydrogen levels in the breath. Because if the lactose is properly digested, so it is not contributing to the hydrogen ion concentration in the breath. So it will be less than 20 parts per million at that time. So if the lactose is not tolerated, if there is an intolerance to lactose undergoing bacterial fermentation, and that's why hydrogen levels in the breath will increase more than 20 parts per million. So that's what is a breath hydrogen test, one of the diagnostic test for lactose intolerance. And then dietary lactose elimination, like if you eliminate the lactose in the diet and see if there is an improvement in the signs and symptoms. If there is improvement, so it indicates there is a lactose intolerance going on. And also when there is improvement and again you reintroduce milk and milk product and see if there is appearance of any signs and symptoms. So that will reconfirm if it is a lactose intolerance or not. So that's what is the one of the diagnosis process that can be used, that is dietary lactose elimination, and see if there is any elevation of signs and symptoms. How do you treat lactose intolerance? So you reduce milk and milk products, and then lactase enzyme preparation like lactate or lactase are effective in reducing symptoms, signs and symptoms, or yogurt or fermented products. Soya based milk food products can be well tolerated in lactose intolerance patients. Probiotics which contains lactobacillus have been shown to shown improvements in lactose intolerance. Supplementation of calcium and vitamin D should be recommended, because when you ask patient to avoid milk and milk products, you got to supplement with vitamin D and calcium. And secondary lactase deficiency, you will have to treat the underlying cause. So this is all about digestion of dietary carbohydrates. Thank you.